Okay, what we're going to do here today is something I use the Boditrak for in a clinic, is to look at a patient's tendency when they rotate. Do they rotate and transfer their weight to one side, or do they tend to pivot? Now this is very pertinent obviously for the golf swing and how an individual is going to approach his takeaway. So as we see right now, I'm fairly balanced there, 50-50. Now if I get into my address posture and I want to simulate a turn, if I transfer my center of mass, which is about my S2, just below the belly button here, when you're stationary, that center of mass is going to be just below your belly button. So as I turn, and if I shift that weight towards my right side, you'll see the COP trace move to the right. Now this is the typical pattern that most coaches are going to look for. Now what you'll see in a lot of individuals is instead of transferring that center of mass as they turn, they're going to tend to move to the left and have a centered pivot where they're moving more around their left hip in a right-handed golfer. So as I turn now, I'm actually backing off with my right hip, and my center of mass now is going to be shifting left as the COP trace moves that way. Again, let's not confuse center of mass with center of pressure, because once we get dynamic, the center of mass calculation is a lot different. But we can use the COP trace here to give an indication. In this case, are they tending to rotate with weight transferring towards the rear foot, to the right foot in a right-handed golfer, or are they tending to have a single pivot action and move around their left pivot point? I find this very useful, and maybe you can use it with patients and clients and especially your golfers to see what their tendencies are. Thanks.